Hello again, Psych 370 students. I hope you're all doing well out there. And welcome to your first video lecture for week 6 of this course. This week, we're going to be wrapping up our unit on classical conditioning by covering some applications of it. Chapter 4 of your textbook is devoted to a discussion of those applications. And guys, the author was able to write an entire chapter on this topic because the principles of classical conditioning have been applied to so many different and important areas, from the treatment of psychological disorders, to advertising, to farming, even to social issues like prejudice. So in this week's video lectures, I'm going to be going over some of those applications with you. And hopefully what you take away from this week of the course, if you haven't already, is that classical conditioning is much more than just an interesting phenomenon. There's a lot more to it than just salivating dogs. It's an important form of learning, and knowing more about how it works can help us solve practical problems. So, if you ask me, this week's material is the fun part when it comes to our coverage of classical conditioning. So, now that we've covered some basic principles and some theory, this is the time where we get to take that knowledge out for a spin and see what we can actually do with it. So, let's go ahead and get started. First of all, the application of classical conditioning that I'm going to focus on in this video lecture involves using it to treat phobias, which, as you probably know, are basically these debilitating fears that some people have, usually of something specific, like spiders, snakes, heights, needles are a big one, so is public speaking. And guys, to start at the beginning with the story about using classical conditioning to treat phobias, I need to talk first about some famous research conducted by John Watson on a baby boy named Albert. So I'm sure most of you guys are already familiar with the so-called Little Albert study. But in 1920, Watson and his assistant, Rosalie Rayner, found that when they first presented Albert with a white rat, he showed no outward signs of fear in response to the rat. So he didn't act like he was scared of the rat. However, he was scared of sudden loud noises. So when Watson and Rayner struck a steel bar with a hammer, Albert became startled and he began to cry. So the loud noise was an unconditioned stimulus that, for Albert, elicited fear as an unconditioned response. Then Watson and Rayner began pairing the white rat with the loud noise. So they'd present the rat, then they'd strike the bar. They'd present that noise. And after a few of those pairings, Albert began to cry and become fearful as soon as he saw the rat, even if the loud noise didn't occur. And so at that point, the white rat had been converted for Albert from the neutral stimulus that it started out as to a conditioned stimulus, because now it was eliciting fear as a conditioned response. And Watson and Rayner also found that other similar stimuli, such as a fur coat, a beard, or a rabbit, would also elicit fear from Albert, even though he hadn't feared those things before the conditioning process began either. And so they concluded that little Albert's fear of the rat had generalized. So, guys, generalization is what we call it when the conditioned response is also elicited by stimuli that are similar to, but not exactly the same as, the conditioned stimulus. And so in this case, little Albert showed generalization because he was afraid not just of the white rat, which is what actually got paired with the loud, scary noise, but also these other stimuli that were similar to the rat. He showed that conditioned fear response to basically anything that was furry, anything that was similar in that way to the furry white rat that he originally learned to fear. So, like I said, that's a pretty famous example of classical conditioning. So, I'd be surprised if most of you guys hadn't already heard that story about little Albert. But Watson used results like those to argue that fears are learned. He said that fears, including phobias, are acquired via classical conditioning. And that view is consistent with Watson's general belief that everything is learned. So, after all, with Watson, we're talking about a guy who once said, quite famously, the following. This is a famous quote from John Watson. He said, "Give me a dozen healthy infants, well formed, and my own specified world to bring them up in, and I will guarantee to take any one at random and train him to become any type of specialist that I might select. Doctor, lawyer, artist, merchant chief, Yeah, even a beggar man or a thief, regardless of his talents, penchants, tendencies, abilities, vocations, and race of his ancestors. So, guys, what Watson is basically saying here with this quote is that at birth, you're a blank slate, right? And then after that, everything you become, every skill, every fear, every behavioral tendency that you have now, everything about you is the result of the environment that you inhabited and the experiences that you had in that environment. That's what Watson believed. But today, of course, we recognize that things aren't so simple. So Watson basically ignored the nature side of the nature versus nurture debate, but there's clearly more to what we fear than just what we've experienced. So, for example, we do seem to be more prepared to fear some things than we do others. After all, snake phobias are much more common than, say, squirrel phobias, right? Lots of people are afraid of snakes. Not many are afraid of squirrels. You're also much more likely to develop a phobia of something like heights than you are to develop one of something like flowers or plastic or anything else that wouldn't have posed much of a threat to our ancestors in our evolutionary history as a species. And so, guys, what that suggests is that we inherit a predisposition. We inherit a preparedness, so to speak, to fear things that it would be in our best interest to avoid. And so the idea is that if our ancestors hadn't feared snakes and heights and things like that, then they probably wouldn't have fared very well in the struggle to survive and reproduce. So natural selection would have acted strongly against the tendency not to fear those things. And so instead, we are the descendants of people who did fear those things, and they've passed those fears on to us. So those fears are more or less innate now, right? They're sort of hardwired in us now because of the fitness advantages that they bestow. Now, that doesn't mean that all fears are innate. We can certainly learn to fear things. But the point is that there are serious problems with this strictly behaviorist idea that Watson proposed about all fears being acquired through classical conditioning. That doesn't seem to be the case. But still, having said that, regardless of how a phobia develops in the first place, regardless of whether classical conditioning was responsible for actually creating that phobia, it's clear enough that, at least in many cases, classical conditioning can be used to help the person overcome it. And guys, the first demonstration of this was actually reported by a student of Watson's named Mary Cover Jones, who used a technique called counter conditioning to treat a fear of rabbits in a 3-year-old boy named Peter. And her strategy with Peter was to pair those rabbits with something that Peter already liked, which were crackers and milk. So, big crackers and milk guy, this Peter kid was, apparently. So Jones treated rabbits in this counter conditioning procedure as the conditioned stimulus. Okay. They're not neutral for Peter, but rabbits are still being treated as the CS here because that's the stimulus that Jones was trying to change Peter's response to. And the crackers and milk served as the unconditioned stimulus. So Jones paired the rabbits with the crackers and milk for Peter. And she also introduced these pairings in stages. So at first, the rabbit was presented a considerable distance away from Peter, but as the pairings continued, she gradually moved the rabbit closer and closer to him. And eventually, Peter stopped showing signs of fear in response to the rabbit. In fact, he was eventually able to let the rabbit sit on his lap and even nibble at his fingers. And so he had learned, in other words, right? His behavior had changed. He had been classically conditioned or counter conditioned in this case. His once fearful response to the rabbit had changed to a neutral one or even a positive one. And so, guys, Mary Cover Jones is sometimes referred to as psychology's very first behavior therapist because she successfully used the principles of classical conditioning to treat Peter's phobia. Now, a few years after Jones reported her work with Peter, another researcher named Joseph Wolpe came along and built on her method to develop a form of treatment called systematic desensitization. Okay, it's called systematic desensitization. And we can break this approach down to a series of 3 steps. Now, as the first step in this technique, the client, so the person with the phobia, creates, with the therapist's help, an ordered list of situations that go from least feared to most feared. Okay. So these fear eliciting stimuli and situations are arranged as a hierarchy from least feared to most feared, which is why this list is called a fear hierarchy, or some people call it an anxiety hierarchy. So that's what you do first. You create this list, you create this hierarchy of things that go from least scary to most scary regarding the person's phobia. So, for example, what you're seeing here on the bottom of this slide is what a fear hierarchy might look like for somebody who has a phobia of flying in an airplane. So, the low end of that hierarchy might be something like seeing a plane from a safe distance. That could be something that arouses just a little bit of fear, just a little bit of uneasiness for the client. And from there, the hierarchy will progress to more and more fearful stimuli and situations, such as sitting in an airport, boarding the plane, cruising at a high altitude, landing, taking off, and so on. So notice, guys, that this list is not organized chronologically, right? From the beginning of the experience to the end of it. Rather, it's organized hierarchically from the least fearful thing for the client to the most fearful thing. So again, the client will work with their therapist to create a fear hierarchy like this. And when they're done, they'll usually have a list that contains around 10 or 15 items. Could be a few more, could be a few less, but it's usually in that ballpark. And then, once the fear hierarchy has been created, the next step, at least in Wolp's method, is to teach these specific relaxation techniques to the client. So, for example, Wolp used progressive muscle relaxation techniques with his clients. So he'd have them tense up one group of muscles for 10 seconds, then relax them for 10 seconds, then repeat the procedure with another group of muscles. So that's how Wolp taught his clients to relax. But other relaxation techniques have been developed too, such as some that involve just having the clients focus on their breathing. But either way, the point of these relaxation techniques is to teach the client to put themselves in this calm, relaxed state, because that's what you're going to pair with the items on the client's fear hierarchy. So, in other words, that calm, relaxed state is what's going to serve as the unconditioned stimulus, essentially, for those pairings. Now, in his original animal studies on systematic desensitization, Wolpe had used food as the unconditioned stimulus, just like Mary Cover Jones had with Peter. But he realized that that approach might not work as well with adult humans, and so that's what led him to use relaxation instead. But anyway, you teach these relaxation techniques to the client. Okay, that's step two. And then, once the client has mastered those techniques, then it's time to start the pairings. And you do this by beginning on the low end of the hierarchy with the least frightening situation. And unlike Jones, who had presented Peter with an actual live rabbit, Wolpe instead had his clients just imagine these situations that they were afraid of. So, in other words, whereas Jones used a technique that we call in vivo exposure, in vivo literally meaning in the flesh, Wolpe used what we call imaginal exposure. So, for example, in the case of a person with a phobia of flying, they would just imagine boarding a plane. They just imagine the plane taking off. They wouldn't actually board a real life plane, they just try to visualize it. So again, that's called imaginal exposure. And there are advantages and disadvantages to both of these types of exposure, but research suggests that they're actually pretty similar in terms of their effectiveness. And in fact, the same could be said about virtual reality exposure, which is becoming more and more popular and which might be especially helpful for clients who either can't vividly imagine a scene or simply don't feel any anxiety as they do so. But anyway, starting on that low end of the fear hierarchy, that least frightening situation is paired with the relaxation until the client no longer reports fear in response to it. So, in other words, you continue those pairings until you have successfully counter conditioned the client's fearful response to that situation. And at that point, of course, you move on to the next item in the hierarchy and you repeat the process of pairing it with relaxation. Once the fearful response to that item has been counter conditioned, then you can move on to the next item and so on until you've reached the most frightening item in the client's hierarchy. So, guys, the idea here is that by the time you get to that top item in the hierarchy, you've already counter conditioned their fearful responses to many other similar stimuli and situations. And so that learning, that change in behavior should generalize somewhat, right? Which would make it easier and quicker to counter condition the client's ultimate fear, the thing that they put at the top of their hierarchy. So that's how systematic desensitization works, and it is quite effective. In fact, some research has found success rates as high as 80 to 90% for the treatment of specific phobias with systematic desensitization. So whether or not this approach works is not really up for debate. It does work. However, what is up for debate is why it works. So some psychologists would say that what's happening here is not so much counter conditioning as it is simple extinction. They'd say that what you're really doing is just extinguishing that fear response to the phobic object. And guys, evidence in favor of that idea is that the relaxation component isn't always necessary for the treatment to be effective. So, what I want to talk about next here are two other forms of treatment for phobias that are really based more on extinction than they are on counter conditioning. One of those approaches is called flooding, which is much simpler than systematic desensitization. So there's no fear hierarchy with this one. And as I just alluded to, there's also no unconditioned stimulus. There's no relaxation. Instead, with flooding, clients are simply presented with the stimulus that they fear, either in vivo through imaginal exposure or in virtual reality, and they're instructed to remain in its presence until their fearful response to it decreases. So, the reason this is called flooding is that the person goes through this period of prolonged exposure to the phobic object, the thing that they're afraid of. So, in other words, they are flooded with that phobic object. They can't escape from it. And so, guys, the idea here is that if you've acquired a conditioned fear of something, then you'll typically deny yourself the opportunity for that fear response to get extinguished because you'll typically avoid the phobic object. So, for example, if you have a phobia of dogs because you were once bitten by a dog, then you will probably avoid putting yourself in situations where you've got to be around dogs, right? When you see one, you might cross the street. If a friend of yours has a dog, you might refuse to visit them at their home. And so, because of that, you're not experiencing the conditioned stimulus. You're not experiencing the dog frequently enough or long enough to extinguish your fear of it. And so flooding is basically a way of arranging those extinction trials for you. It's a way of presenting you with the dog, the CS, or having you visualize a dog, then preventing you from performing your usual escape response. So having you sit with that anxiety that you're feeling for a little while, and therefore forcing you to experience extinction because the dog, the CS, is not being paired with the bite, the US. And so as a result, you should stop associating dogs with bites, and your conditioned response, your fear, should get extinguished. It should go away. So that's how flooding works. Like I said, it's a simpler approach than systematic desensitization. And it's basically about trying to put the client through extinction so that they'll stop exhibiting those fearful responses to the phobic object. Now, guys, flooding has demonstrated effectiveness in treating phobias. Okay, it works. And it also has the advantage of being faster than systematic desensitization since the client doesn't have to work through a hierarchy or learn any relaxation techniques in order for flooding to work. However, the obvious problem with flooding is that not everyone can tolerate it. Not everyone can tolerate that prolonged exposure to the object of their phobia. So many people won't agree to the use of flooding because their initial anxiety level is just too great. And the dropout rate is also much higher with flooding than it is with systematic desensitization. So flooding does work in many cases, but it's clearly a much riskier technique, I guess you could say, than systematic desensitization is. And so for some people, a better option might be something called graded exposure, which I like to describe as a sort of hybrid approach to treatment because it combines the extinction and prolonged exposure aspects of flooding with the gradual and hierarchical aspects of systematic desensitization. So, for example, if you have a phobia of spiders, then you might make a fear hierarchy just like you would with systematic desensitization. You might create that list of stimuli and situations that scare you when it comes to spiders. It would again go from least scary to most scary. So it would be hierarchical like that. And then, starting at the low end of the hierarchy, starting with that least scary thing, you'd work through the list and you'd get exposed to each item, whether virtually, in vivo, or through imaginal exposure, until the anxiety that you felt dissipated. So, for example, the therapist might first have you just look at a picture of a spider, right? So maybe you identified that as the first thing, the least scary thing in your fear hierarchy. But it's still scary for you, it still elicits fear from you. And so you'd keep looking at the picture until your level of fear to it came down a little bit. For example, until your heart rate had declined to a certain level. Once that happens, then you move on to the next item in your hierarchy, which might be holding or looking at a toy spider. And that's probably going to renew your fear somewhat, right? Your heart rate will probably go up again when you're first exposed to that item. But again, that fear should eventually subside. So as you continue to get that exposure to that stimulus, as you sit with that anxiety that you're feeling for a little while, your heart rate should eventually come back down again. Once it does, you'd move on again to the next item in the hierarchy. And you'd keep going like that. You'd keep getting that prolonged exposure to each item in the hierarchy until you had worked your way through the entire thing. So again, graded exposure is kind of like flooding because you're just exposing the person to these stimuli and trying to extinguish their responses to them. You aren't pairing those stimuli with the US like you would in a counter conditioning procedure. But the reason it's called graded exposure is that, again, you don't just jump to the top of the hierarchy here, right? You don't just start out by flooding the person with the actual object of their phobia. You build up to that gradually instead. So that's how graded exposure works. And guys, as another example of graded exposure, I've got a video for you to watch now about how it was used to treat a case of agoraphobia, which is where a person becomes so afraid of having a panic attack that in some cases they refuse to leave their own home. So in this video, we'll see how one particular client's agoraphobia was successfully treated through the use of a graded exposure technique.
I was too scared to even go out because I thought it's going to get worse when I go out and I'm not going to be able, I'm going to faint or I'm going to do something crazy or something terrible is going to happen to me and I'm going to die. I think when I realized I had agoraphobia was when I wouldn't go to a shopping center or anything, and I think that was, I wouldn't drive my car and I wouldn't go to a shopping center, and those are when I had my two first panic attacks. Well, not my first, but my first major ones. And I think, so I realized that because I had them in those situations, I was actually scared to go back into those situations.
In order to overcome those sorts of fears, you then have to start engaging in what we might call graded exposure. That is, intentionally doing the things you're scared of in order to prove to yourself that I can cope, I can do it, this situation is not going to hurt me. I'm not going to have a panic attack, or I'm not going to die or have a heart attack in this situation.
So the way to start doing that is to make a list of all the sorts of situations that make you anxious. For example, going on the train, going to the shops, having your hair done, situations often where you wouldn't be able to get out of easily or get help. And then we get you to start working at the least anxiety-provoking situation.
So it was a matter of starting very slowly, setting myself tasks every day, small tasks to begin with. I didn't sort of rush into it. For me, a very slow method was what I needed. And I used to just, as I say, go to the post office, post a letter. The next day I might have gone to the post office to post a letter and to go to the bank to make a deposit and stand in a queue in the bank, which was very hard, really scary. The next day I would go to the shops and buy a couple of things, and slowly from there, from walking to the shops, I eventually sort of started driving short distances. And I think from doing that, slowly it sort of sunk into my head that nothing terrible was going to happen to me. And that's how I built up from there, going further, doing more, staying at the shops longer, standing in a queue for longer, driving further distances.
Now, there's a few important rules about graded exposure in order to make it really work for you. First of all, you must stay in the situation until you feel your anxiety coming down.
You have to actually stay in the situation before, just to let the panic attack subside, and then you can go out of the situation. Don't run out of it as it's happening, because you're automatically going to assume that it's the supermarket that gave me that panic attack. It's the car that gave me that panic attack. And it's an automatic reaction to associate the two together.
It's also important that you don't use any other means of escape, if you like, which includes taking a pill like an anxiety relieving medication, or using alcohol in the situation to relieve your anxiety. So you can't use any other artificial means of bringing your anxiety down in the situation either, or you won't get the benefit.
Okay, so like you saw there, with her therapist, she made that list of situations that made her anxious, like going to the post office, going to the bank, going shopping, driving, and so on. And then she started going through the list, starting with the least threatening thing, starting with the smallest task that she thought she could handle, like dropping off a letter. If she did experience anxiety, she didn't immediately try to escape from the situation, right? She stayed in it until she felt her anxiety subside. And then once she stopped feeling anxious when she performed that task, she moved on to the next, slightly scarier task. And so, again, guys, graded exposure is like systematic desensitization because it involves that gradual sort of ramping up process from the less threatening things to the more threatening things. But it's also like flooding because it involves prolonged exposure to each item in the hierarchy, and also because it clearly relies more on extinction than it does on counter conditioning, since there's no US, like relaxation. And also, like flooding and systematic desensitization, graded exposure is often quite effective. So, for example, one study found that a single 2-hour session of graded exposure was sufficient to reduce fear in a sample of people with blood and injection phobias. And guys, almost all of those people still showed either full recovery or at least significant improvement at follow up tests that were done an average of 4 years later. So, regardless of whether we're talking about techniques that are based on counter conditioning, like systematic desensitization is, or techniques that are based more on extinction, like flooding and graded exposure are, it's clear that the principles of classical conditioning can be applied in very effective ways to the treatment of phobias and other anxiety disorders. Okay, well, I'm going to stop this video lecture here. So please let me know if you have questions about any of this stuff. And please also make sure to check out the next video lecture for this week, which is about how classical conditioning can be applied to advertising. Okay, take care, guys.